Good morning, everyone. This is Sexologist Dr. Uttam K Dave, and I am here to present next topic, which is sexually transmitted diseases in gay and bisexual men. My dear friends, I have worked with lots and lots of patients who have no idea what a sexually transmitted infection is. They do know, they have heard about these infections, but they think that this is something which happens only to bad boys and not to good boys like them. So this basically video is aimed at gay and bisexual men who are very promiscuous, and this is not to scare them but just to make them aware of what an STD is and other things which they need to take care of. So let's begin with the introduction. Sexually transmitted diseases are diseases that can be transmitted through sexual activity. As the name suggests, these are transmitted through sexual activity. STDs are more infectious than HIV and they are generally easier to transmit, which makes it more and more dangerous. If you are having unprotected sex, you could be the next victim. However, with improvements in treatments and vaccinations, most STDs do not present the same health risks as HIV. As of now, we all know that HIV is something which will ultimately lead you to your death, because it develops into full-blown AIDS and then you die. At least in case of an STD, we do not have such a thing happening. No matter how safe your sex life is, some STDs are hard to avoid. We'll come to it later on why I am saying that. Symptoms can take months to show, and some STDs can have long-term effects. There are some STDs where symptoms are hidden and you do not even know that you are infected. Maintaining good sexual health involves not only practicing safer sex, but also visiting a skin specialist for regular checkups and receiving treatment when necessary. Unfortunately, what happens is once a man or a young boy is infected, they are too embarrassed to even go and see a male doctor. I have seen cases where my male patients have come to me, and when I said that I need to examine them, they were very reluctant to get examined. So that was very surprising, because even being of the same sex, they had so many inhibitions. Probably they were too shy or too embarrassed to face me because of a sexual mistake which they had done. For sexually active gay men, some STDs may be unavoidable even if you are practicing safer sex. Right? We'll come to it later on. Often you will be unaware of being infected with an STD, as some STDs have no signs or symptoms, and some symptoms may be hidden or disguised. Now this can be very dangerous. You wouldn't even know that you have caught an infection. The most important thing to remember is not to panic or feel embarrassed if you think that you have an STD. Now both the things, actually, panic and embarrassment, actually prevent you from seeking help from a doctor, which should not be the case. There should be no fear, because once you are under treatment, your fear will go away. There should be no embarrassment, because the doctor is just a male like you. He is there to help you. He is not there to make you feel more shameful or make you feel more embarrassed. It is important to seek good medical advice and to go to a skin specialist for a checkup. How often you decide to go for a checkup will depend on how often you have sex with new partners and what you do with them sexually. Now this is very important. If you are having safe sex, then probably your visits will be very few. But if you are having lots of sex partners and you are practicing, for example, anal sex or oral sex and things like that, which are very harmful, unprotected, then you need to visit your skin specialist off and on. Skin specialists have been established specifically to deal with the treatment of STDs, and the services provided free of charge. That would happen only in a government hospital or at a very reduced rate, not in a private clinic. Don't be put off by the tales you may have heard about such clinics, of bizarre implements being used or of meeting someone you know. And even if you meet somebody you know, what difference does it make? So probably they are there for the same reason, and you should not be embarrassed because of that. It's much easier to confront somebody then and there than to not go to a doctor for the fear that you may be caught there. It is more important to benefit from any treatments that you may need than it is to worry. Definitely. Try to be honest and descriptive, as this can sometimes reveal a requirement for other STD treatments. Now, In our country, we don't have special clinics for sexually transmitted diseases. Let me tell you that it's a skin specialist. A skin specialist is a dermatologist. He is the one who generally treats you also for sexually transmitted infections. So you don't have a special, separate clinic saying just STDs. And also, even when you do visit a skin specialist, nobody really knows why you are there in the first place. It is likely that you will be tested and treated on the same visit, although you may need to make follow-up visits. Yes, probably after a month or maybe after 15 days, after 21 days, as and when the skin specialist calls you. It is important to follow the guidelines and advice for any treatment received. Now, this is very, very important. We'll come to it about the guidelines, what you need to follow. Even if you don't think you have an STD, it's a good idea to go along to a clinic for a general sexual health. You can also get your vaccinations against hepatitis A and B while you are there. In later videos, I'll tell you what is the need of hepatitis A and hepatitis B vaccination. By practicing safer sex to prevent HIV transmission, you will also be taking the most important steps to prevent transmission of other STDs. Naturally, if you are protecting yourself against the biggest STD, you're protecting yourself against the other STDs as well. Unprotected anal sex is the most risky form of sexual activity for the transmission of almost all STDs and for transmitting HIV. And it is a very sad state of affairs that most of my patients who come to me for treatment or for advice or for consultation are the ones who are having lots and lots of sex partners, and they are practicing a lot of unsafe sex. Most of the times in a hurry. It's either in a in a public toilet, or maybe in a garden, or maybe behind the bush, or maybe with a truck driver. And these, mind well, these are not boys who are poor and that's why they are doing things like that. It's just because the availability of the partners is at such places, and they do not want to move to a safer place or a healthier place, or want to practice safe sex because they do not know what is safe sex in the first place. So that makes these people much more vulnerable to diseases. Some types of sex which carry no risk of HIV transmission can be risky for transmitting other STDs. For example, one example is pubic lice. All serious STDs can be controlled with treatment as long as they are identified early enough. So that is the reason why you cannot be waiting for things to happen on their own. You cannot assume that just because you don't go and see a doctor, the thing is going to get cured on itself. It doesn't get cured by itself. You have to seek the help of a doctor. So there are obvious benefits of going for regular checkups at a skin clinic. Okay, fine. So this was a brief introduction about STDs, and every man in any part of the world, whether he is gay or bisexual, needs to have this basic understanding of sexually transmitted infections the moment he ventures out before his first sex encounter. It's no point in trying to know things when you've already had an infection. Prevention is always better than cure. So make sure that you watch this video very carefully. Think about what I have said. Try to discuss these things with your sex partner before you jump into bed or you actually have sex. That makes it much more easier for both of you, because both of you will remain uninfected, and then you can enjoy a good sex life. Not after you've had sex and you've been infected and then you blame each other and follow it up with a lot of mutual blame. It doesn't really have to be so difficult. So thank you very much for watching this video, and next week I'll come up with discussion about a sexually transmitted disease, which is chlamydia. So goodbye and thank you for watching this video.